The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to the Meet the Doctor podcast. My guest is Dr. John Mesa. Welcome, Dr. Mesa.
Thank you, Eva, for inviting me to this podcast.
Tell me a little bit about yourself.
I am a board-certified cosmetic plastic surgeon. I have 3 locations. I have an office in New York City, Manhattan, another one in New Jersey, and another one in Miami. And I specialize now in facial procedures. Basically, people knows me because of the buccal+fat+removal and chin reconstructions and face+lift and neck lift under local anesthesia. Those are my fortes.
There's a lot to unpack there. Let's start with local anesthesia. So most surgery is not done under local anesthesia, and sometimes there's some controversy about this. Why are you doing mostly local? All local?
100% local.
100%.
I'm proud to say that for the last 2 years, I haven't brought anybody to the hospital to get surgery under general anesthesia. I do everything in my office under local anesthesia.
And was that out of necessity or preference, or how did you end up there?
No, that started when I was doing my 3rd fellowship in University of Alabama. My professor was doing facelifts under local anesthesia in quotation, but the patients were in a lot of pain. And I told my professor, I said, look, that's not right. Patients should be painless. Because I did a fellowship the year before in craniofacial surgery, that is reconstruction of the face. I said, look, I can numb the nerves and all the stuff, and I can help you with that. He said, look, if you can improve the technique, let's do it. And I started to do it to the point that now I do almost everything on the face, completely awake, under local anesthesia with 0 pain, which is, I like it because, first of all, eliminates all the risk of going to sleep. So 100% of the risk of general anesthesia or IV sedation are waived. Secondly, nowadays it's more convenient for the patients because now you don't have to have a chaperone or like a companion to come to get surgery unless it's the eyes. You can get you come get the surgery done by yourself and then you leave by yourself, so which is more comfortable for the patient in addition of being more safe.
It sounds like it's less invasive or less serious than going to the dentist.
Correct.
Okay. This is really interesting. So go back to 3 fellowships. You sound like someone who loves to go to school.
Yes, I trained for 18 years.
18 years. So you started when you were 10. What were your 3 fellowships?
The first one was in plastic surgery research at Harvard. The second was craniofacial surgery at University of Michigan. And the third one was about aesthetic surgery of the face and University of Alabama.
And were you continuing through these fellowships because you weren't sure what you were going to do, or just like,
No, the first one was the price that I had to pay to get into plastic surgery because I am a foreigner. I am born in Colombia. So as a foreigner, to get into plastic surgery in America is very difficult. So I had to pay my dues. That's what I had to do, 5-year fellowship in research to get into plastics. The second one is because I always wanted to specialize in the face. So I wanted to be a reconstructive surgeon. Then I wanted to improve my reconstruction from the aesthetic side. So that's what I did, the second clinical fellowship, 3rd one in total. And then after that, I decided to do cosmetic surgery because ultimately is what I like the most.
So let's go backwards again. You came from Colombia.
Yes.
Certainly there are medical schools and plastic surgeons in Colombia, but why did you want to come to the United States for that instead?
Because it was easier for me to become a plastic surgeon in America, even though it's so difficult than in my country. And the reason is different to America. In South America, when you go into a residency, you either have to pay to be in a private university or you don't have to pay. But my family was very poor. They couldn't support me, so I needed somehow to pay for my bills, my meals, my housing, books, everything. And I found out in America, when you are a resident, you get paid. It's a basic salary. So for me, it was more easier to get into one of the most difficult residencies in the world that in my country.
Okay, so I'm starting to see a pattern here with you that you like to do things that are very, very difficult.
Correct.
Okay.
And that nobody has done before, or very few.
What other things have you done that no one has done before?
I mean, the procedures, I do my facelifts and neck lifts completely awake under local anesthesia. People don't believe me. And because some doctors do what is called local anesthesia and sedation. They give you pure IV sedation. No, my patients are fully awake, talking to me. We are talking. The other day, I did a movie director from Hollywood, and I have an assistant that he used to do a lot of movies for shooting and all this stuff. And they were talking all the surgery while I was doing the face. So people tell us that I'm a little bit crazy about that. And another thing is after my last fellowship, I ended up doing a textbook about reconstruction of the face. It's a big book that trains plastic surgeons, and it's an official book of two societies, the American Society of Craniofacial Surgery and the American Society of Maxillofacial Surgeons. And I'm the lead author of that book, and nobody has done anything like that.
How many years does it take to write a textbook of that size?
It took me like 6 years.
And who was helping you? Other doctors?
I invited some other doctors to write the chapters, but when you are the main author, at the end you end up catching up with the incomplete work, all the everything. So it was a lot of work.
So you're also the project manager.
Correct.
That's actually harder than the writing sometimes.
Yes.
Is research still a part of your everyday life at work now?
Right now, no, because I am no longer doing academics. And right now, what I'm doing is more like a clinical work and marketing work.
If you had unlimited time to do whatever you wanted to do on the research side, is there something that you would study?
Yeah, I will continue my research that I did at Harvard when I was doing tissue engineering, that I was creating cartilage graft through injections. That's something that I'm really passionate. I was very passionate. I did 5 years of research, and I would like to continue to do that. But for that, you need a basic research lab.
Do you think you'll get back to that someday?
Yes, at some point, yes. When I kind of grow a little bit more my practice, I have like a roadmap of where I want. When everything is in standby, then I will kind of contact one or two universities to become like an associate professors, and then start doing a little bit more of that.
That'll be exciting. Okay. So at the beginning, you told me that you are practicing in both New York, New Jersey, and down here in Miami, where we are today.
Correct.
How often are you traveling back and forth?
My office in New York and New Jersey are close. It's like 45 minutes in between. So depending on the day, I kind of commute to either one. And the one here in Miami, right now I'm coming only once a month. I operate on Saturdays. The first Saturday of the month, I fly on Friday. Saturday, I operate all day. Sunday, I go to the beach and do brunch with my friends here in Miami. And then Monday morning, I fly back.
So this Miami office was a plan to be able to go to the beach once a month?
That was the excuse to force me to go to the beach. Because before I had the office, I always wanted to come to Miami because it's a very Latin environment and the weather is nice. And as a South American, I like Miami. And I always found an excuse not to come. But then now that I have patients, I have to come. So there is no excuse about that.
Makes sense. Someone's got to do it. Do you see any interesting differences between your patients in New York City and down here?
Yes. One of the main differences is everybody arrives on time here. Even though there is a big Latin, I do, because I speak Spanish, I would say 50% of my patients are Spanish speaking. So, and Latin culture, by definition, arrives late everywhere. So in New York and New Jersey, most of my patients arrive late. But here in Miami, especially the Latinos, they arrive on time or 15 minutes before, which is shocking to me. So that's why I'm able to pack my day with surgeries and go very efficient because everybody arrives on time.
Wow.
Why is that? I have no idea.
We're going to have to figure that one out. That's really interesting. They clearly respect you very much and respect your time. Or maybe it's your staff and they're telling them.
No, it's
No?
the same staff. I have the same staff controlling the 3 offices, but here in Miami, everybody arrives on time. Why? I have no idea.
Are there aesthetic differences, or are patients the same everywhere?
In my practice, I think they're actually the same because now I'm very specialized in certain procedures of the face. So because I'm very focused in basically like a 7 procedures, basically what I do, all the patients are the same in either in New York, New Jersey, or here in Miami.
One of those procedures is the buccal+fat+pad+removal.
Correct.
This procedure's been kind of hanging out on social media and People magazine, and it's popular.
It became popular like in December this year.
Yeah. So it's everywhere. And now, of course, as soon as it becomes popular, then you start seeing the bad results show up in the same places. And so I wonder if you can talk about that procedure a little bit. And I think what I'd like to know is when it goes wrong, what are they doing wrong?
Yes, I mean, buccal+fat+removal, why it became interesting. When I finished all my fellowships, all my trainings, I always have been fascinated about the face. That's the reason why I became plastic surgeon. I wanted to make the face more beautiful. And I noticed that always people in the movies, in Hollywood, in TV, they look very good compared with the regular people on the street. And then I started to do some research, and I found out about that procedure. But at that time, in the early 2000s, nobody talked about that. That's what I call right now the best kept secret in Hollywood, because my hypothesis is that everybody in Hollywood does it, but nobody knew about that. So I started to do one or two. I researched about the technique. I was not trained in adults. I did buccal removals in kids. In kids, when they have cleft lips and cleft palates, if they have a hole in the palate, you get the buccal fat pad and then you patch the hole. It helps to heal that, but it's not for aesthetic purposes. So I started to do some ones, and then they realized that patients started to look like celebrities. So that's why I started to do a lot, to the point that now 50% of my practice is just buccal removal. So now with all these years of experience, why things can go wrong. One is when you are not experienced in the procedure. Secondly, when the surgeon is not really well trained or doesn't have a good aesthetic eye. And third, when the patients are not well informed or are not told that the buccal fat removal is not just the solution to achieve their goals. For me, it's very important, anybody that is going to get the procedure, to have high cheekbones, because everybody say, oh, I want to look like Bella Hadid. And you say, yes, to look like Bella Hadid, you will need a buccal fat removal. But for that, you need to have the Bella Hadid cheekbones. You need to have the Bella Hadid jawline. You need the Bella Hadid chin. And that's when things go wrong, when you do a buccal fat removal in somebody that don't have those features, and then the results are bad. So that's why, and I learned that early in my career. And I tell all the time, I had a patient, I knew she needed to have cheekbone fillers to get a good result. She convinced me not to do it. I did the surgery. She looked a little bit aged, because that's the problem. If you do buccal fat removal with no cheekbones, you're going to look aged. She wrote a nasty review in Real Self. If you go at the bottom of my reviews, that review is there. I was devastated, and I had to bring her back. I had to do fillers. I fixed her, but she never revised the Real Self review. That's the way that I learned. So that's the point. Like when you do the procedure in somebody that doesn't have what is needed to have a good result. And right now I'm very strict. I say, look, you have no cheekbones. Unless you don't do cheekbone fillers, I won't do your surgery, because I don't want you to have a bad result.
Oh, I wish we didn't have to learn the hard way.
Yeah. But that's... I learned in a book or somewhere, I don't remember the source, the word expert, the definition of expert. And they say, expert is somebody that has done every single mistake in the past. And that's how you become an expert, because you know from mistakes what not to do in the future.
I love that.
So it's a way to see negative things in the past as a positive way in life.
Is there anything that you wish your patients knew before they came to see you?
Yes, I would like them to be certain of what they want. Because sometimes what they have in mind is not what they are truly, really want. And it's very important for patients to kind of do a little bit of internet search and try to figure it out, be a little bit more informed. Because I hate when patients come and say, oh, Dr. Mesa, I want to improve my face. what can you do for me? I said, like, no. I mean, as a plastic surgeon, I can do everything I can do. But no, my job is not to sell you surgery and make money out of that. In my practice, or the way that I practice my plastic surgery, is to make you feel better. And for that, you need to know exactly what you want. So that's why I tell the patient, no, tell me what bothers you, and then I can tell you how I can help you to improve that area that bothers you.
Are people finding you now for the things that you're known for?
Oh, yes.
Yeah. So are you actually known for being the buccal+fat+pad guy?
Some people tells me, I mean, my colleagues, I just run into a couple of friends here, and everybody that I met, and if they have with another friends and they want to introduce me, they say, oh, let me introduce you. This is my dear friend, John Mesa, Dr. Mesa. He's the king of buccal+fat+removal. So that's what the people calls me, the king of buccal+fat+removal.
Now I know the king of buccal+fat+pad+removal and the king of the BBL. I know both kings, both cheeks.
Yeah. Mm-hmm.
Okay. This is a great day. If someone is interested in finding out more about you or reaching out to possibly schedule a consultation, where should they look?
Since we're in Real Self, the first place is to go to realself.com and search my name, John, John, and last name Mesa. It means stable in Spanish. It's Mesa. And the second is the website, is drmesa.com. And then on Instagram, dr.mesa, number 2. And that's where they can find information about me. And I also own the buccal+fat+removal and buccal+fat+pad+removal handles on Instagram.
Excellent. And I will put all of those in the show notes so they're easy to find on the
Thank
podcast.
You so much. That's very kind of you.
Thank you for sharing yourself with us today, Dr. Mesa.
No, thank you, Eva, for your invitation to this amazing podcast.
Thank you. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.